We're all about nutrition this morning. The Nutrition Week here in Kenya began on the 31st of August. It's running across to the 6th of September. And today we're paying special focus on food fortification, the merits and demerits, if you like, of packaged foods. And joining me in studio this morning is Gladys Mugambi. She's a nutrition program manager with the Ministry of Health. We also have Adan, Kabelo, who's Global Alliance for Improved Nutrition, or if you like, GAIN, country director. Also joining us is Juliana Auma. She's representing Spina Bifida Rep Association, and Sam Ochieng, who is CEO Consumer Information Network. Thank you all for joining us this morning. I'll begin with you, Gladys. First, talk to us about the Nutrition Week, how that came about, and what you've been doing for this week.
Okay, the Nutrition Week came about because nutrition has been found to be very important in our health and development. And in Africa, we've been asked to organize such events, and we have a nutrition week that is a nutrition day that is supposed to be in October, but because there are many activities, we decided to have it this week as Kenya. So we are creating awareness and this advocacy on nutrition so that everybody can take action on what they are supposed to do. Okay.
Kabelo, Global Alliance for Improved Nutrition, of course that closely linked with what we are focusing on, food fortification. For many, they perhaps will not understand what we mean when we say food fortification. So how do you come in and perhaps define for us what that means?
Well, thank you very much. And Global Alliance for Improved Nutrition is an organization formed by the UN in 2002 to fight malnutrition in the world. In Kenya, we established the office here in 2010, and we are cooperating with the Ministry of Health mainly to focus on a number of nutrition agenda in this country, and key among them is food fortification. What fortification means is, you know, people, the theme for this week is you are what you eat. So food is actually a very critical component of your health. And so if people are conscious about the food that they eat, then they will not need as much medicine as they're using today. So what we are doing is to see how that food can be more nutritious for the body of the human beings. And fortification is a concept that has been practiced in many countries in the world. It's a new thing here, but it is about adding the necessary minerals to the food that people are consuming. The food that we eat are mostly sifted or mainly cleaned food that may not have a lot of minerals, and therefore how do we input minerals back to that food so that people are eating what is required by their body. This is what we are working on with the government, particularly Ministry of Health, with industries, with consumer organizations here. So we'll explain that more.
Okay. Juliana, talk to us. You have a child with spina bifida. What is that condition? How did it come about?
Well, spina bifida is a condition that someone is born with. I realized my daughter had it when she was born. So I came to know more about spina bifida after she grew up, and I went to Kijabe. That is where I learned so much on the condition. And what I learned that really touched me is the fact that we can prevent spina bifida to some extent. When I was getting pregnant with my daughter, I didn't have enough levels of folic acid in my blood. So we've come to know that when a woman has enough levels of folic acid before she gets pregnant, then the risk of having a child with spina bifida is reduced by 78%. I'm saying before a woman gets pregnant because it happens very early into the pregnancy. When the pregnancy is about 21 to 28 days before the woman knows she's expecting a baby.
Okay.
Yes.
All right. Ochieng, how does the Consumer Information Network come into this nutrition conversation?
Yes, basically Consumer Information Network is a consumers organization.
Yes.
So we are there to create awareness to let people know that the benefits of fortification, how they need to check on these foods in terms of labeling and all these kind of things. We are also quite engaged in terms of policy advocacy and watching on the institutions, watching on the government and the industry to do the right things. So basically, that's where we come in, watching over the industry, watching over the government, and also creating that awareness and doing the right policy advocacy.
Yeah. So in your opinion, why has that not been happening, food fortification? Because he mentioned that it's a new practice now, something that's trying to be encouraged. Why has it not been happening so far?
I think in terms of fortification is basically a new concept in Kenya, but we already had those times when things like salt, iodizing salt and all that has been taking place. So we can't say that it's totally new, but I think that the levels of fortifications are going up now. We are getting more products into being fortified, and I think it's basically the right timing to get people to be more aware and to get the government to do more, because this thing, of course, it should have happened long before. But I think that there has been also other options. I think it's not only fortification. Fortification is a good thing. It goes fast, but of course, people have been, having eating much more varieties of food. There have been other government measures to deal with this. But I think the levels in terms of how the refinement of food now, it calls for much more action. So it's actually timely.
Yeah, but it's not a practice that is being embraced by the players in the industry. Why is that you find some resistance to this food fortification?
Okay, I could say that after we got the support from Global Alliance for Improved Nutrition, the uptake has increased. Most of the industries are now fortifying. Those who are not able to fortify is because they do not have the technology. And that is the kind of support that we require from our partners. And so far, the GAIN has helped us to get those industries together, and we are able to train them, and they're now doing the fortification.
Okay.
And the focus mainly is on maize meal, wheat, and oil. The maize meal and wheat is a bit difficult, and they require equipment that are installed to the mills so that they're able to put in the nutrients in the levels that are required. So the uptake is improving.
It's improving.
Yeah.
And you've touched on what I was going to put to Kabelo in as far as what foods are we talking about and what exactly happens, because when food fortification, for somebody who's perhaps just joining the conversation and saying, what are these people talking about? What foods are they and what happens? Because you talked about adding of minerals. So when flour is processed from maize for it to become the final product, why is it that it needs something to be added at the end? What happens in between?
Yeah, Sophia, let me put a little bit of context here. The context in which we are is very serious, actually. If Kenyans knew the levels of deficiencies that we are suffering in this country, 1 in every 3 child in this country is stunted. I don't think Kenyans know what stunting is about. The general, even the ones who are educated like me and you. Stunting has a very significant impact on the mental and physical growth of a child. When a child is not growing mentally, that child could be associated with stunting or deficiencies of certain minerals in the body at the beginning. When we see, the likes of her child on the streets, these are people who have deformities that could have been prevented. It's not, and you cannot prevent them after it has happened. You can't treat them. It has to be prevented. And so when we talk about lack of certain vitamins like vitamin A or iron amongst women of childbearing age is quite significant. In fact, a lot of deaths or maternal deaths, estimates are quoted at 53% of maternal deaths is related to malnutrition. If you compare that to AIDS, for instance, AIDS is only 3% associated to that kind of death. So it's quite a real problem in this country that we have to be awake to. So in that context, how do we ensure that Kenyans get the nutrients that are required in their body? One way is to go industrial fortification. Industrial fortification is where, the necessary minerals, and we know from statistics by Kenya Bureau of Standards, by statistics that has been, surveys that has been done in this country, what minerals are lacking. So these minerals can actually be put in that food. And it's not that that mineral has not been there before. In fact, if you consume a whole food, certainly you will be having those minerals. But in the process of processing food, those minerals are removed. So we're asking these minerals to be returned back, maybe with an extra more. That's industrial fortification. So getting back those minerals. But there is something else that I want to mention here. Apart from industrial fortification, there is what we call the home fortification. This is where, we're a poor country, and therefore a large number of our population do not have luxury of eating varieties of food. Because for you to get all the minerals that are required, you need to have access to varieties of food. Not many Kenyans can afford. So if Kenyans are depending on one staple diet, then definitely they will be losing other minerals. So how will they be getting the other minerals? That's what we call now the home fortification package that we have is being distributed by Ministry of Health. GAIN has contributed to availability of those sachets, small sachets. So when you prepare one meal, if you say it is ugali and ugali and ugali, or githeri and githeri and githeri, you sprinkle that sachets on the food that has already been cooked. It has 15 minerals and elements that are required by the human body. So you don't have to worry about, getting variety of food which you can't afford. These are provided free in the health centers.
So they're free?
They're free.
Okay.
They're provided by health centers free. But people don't know about it. The mothers of children who are supposed to be feeding their children on this do not know about it. So they don't ask for it, and they don't know how to use it. The health services that are supposed to be providing that are also not quite active in
Which I guess brings that role back to the Ministry of Health. What is the ministry doing about that to ensure that there's knowledge out there that there are these services which could be helping prevent many deaths and helping people live quality life, but don't know that it exists?
Yeah, on the micronutrient powders that he has mentioned, we have been doing some piloting to see how we can upscale. And at the moment, we are focusing on the younger children first, and then we shall have it even going even to schools, where children are given the school meals and then the nutrients are added to the food. So it's being upscaled, and once we reach every part of the country, we shall start creating awareness so that even people can start looking for those vitamins wherever they are sold, so that they can even just use them at home.
Okay. All right, Juliana, so spina bifida does not have a cure. Does your child then have to live with this, or what then how is management of the disease?
Yeah, spina bifida is a very complex condition. My daughter is physically disabled. She uses a wheelchair for long distance and crutches and calipers for short distance within the house, within the compound. She also has a hidden disability. She's not able to control her bowel and her bladder. She empties her bladder using a catheter after every 3 hours, and also she follows a regular bowel program. Every evening we have to empty her bowel. If you don't do that, she ends up messing herself within the day when she takes a meal. And also you as a parent, you also have to consider what your child eats. If you continue giving them refined foods that make them constipate a lot, then they have a bigger problem. Because children with spina bifida have a bigger problem with constipation. Even before they grow up, they have a bigger problem with constipation. So the food they eat has to have a lot of fiber, and they have to drink a lot of water to allow them to empty their bowels the way it should be.
And you're saying this is because you mentioned folic. It is what you did not have enough of before you got pregnant.
That is what I've come to learn after taking care of my child. I've come to learn that folic acid is very key when a woman gets pregnant, it's very important to have it in good levels in your blood.
Okay.
Yes.
Let's come to you, Ochieng, and in terms of getting this food, having those nutrients added,
Yes.
or the minerals, it comes at a cost, right? That means that then if this food is fortified, the expense as well goes up.
Actually, it shouldn't be very expensive.
Okay.
That's what we as consumers know. It shouldn't be too expensive, because in terms of the processing of food, you take something like maize meal. By the time it gets onto flour, these people have removed a lot, and basically that's what Adan is talking about. The way we get more and more refined food, we are losing those, and you find that at times you have your chicken, taking more nutritious meal than what you're taking. So the process, these people are making money. Whatever they are removing, they're also selling it at another cost. So basically, there should be a way in which that cost is not too much for the consumer. Because ultimately, if the cost is high, then we are getting back to the same problem. And I'm glad that they're introducing this sachets which can be used at home, because you talk about refined food being added onto, those minerals being added to refined food. But there are also those people who do not buy, the shifted maize meal that you buy in supermarkets and all that. So we need to also to find a way of taking care of those people who are at the portion meal level, and those people who are not getting on to the supermarkets as well. Yes.
So which foods have had the maize flour? What else are we talking about? The things, the food stuff that undergoes this refining that perhaps will destroy the minerals or the nutrients?
The maize flour, actually, most of the cereals, you find that nowadays they have a lot of byproducts. And by the time you're having so many of the byproducts of each of them, then of course you are reducing the quality in terms of the nutrients in that food. Okay. So all those processed foods, there is a degree of them losing so it's not just the maize flour. You talk of
it's a wide array.
It's a wide range of foods.
Okay. Yes. As we bring this to a close, I'll come to you in terms of, are we moving as a country, the world, to supplements, because food is perhaps not giving all that one can get because of the processing that we're seeing, that is seeing the destruction of the very important minerals? Are we going to be going to more and more of supplements? Because more and more I'm seeing people, they'll have a little bottle somewhere, and after a meal you see them taking some of these supplements because things are getting bad. And why is it we've gotten there finally, from both of you?
Okay, I think, it seems we are moving towards having supplements more than eating our available foods locally. But we should balance. The whole foods are, and indigenous foods are usually more nutritious and cheaper than having to take supplements. But because of the development and people having a lot to do, and depending on foods which are processed, then supplementation comes in. But also, it's important that some foods are processed, because if they are not, then we are going to have food insecurity. So if we say that maize should be always milled and we use it whole, then it gets bad within 2 weeks. And that way we are going to lose a lot of food. So processing it is good, but we are saying then if it has to be processed, then the nutrients have to be returned, those that have been removed.
Finally, from you, what is your rallying call to everybody watching, and as far as ensuring their nutrition is important? You said we are what we eat, so everyone needs to pay a lot of attention to that.
Yeah, I think Kenyans need to be very conscious of what they're eating. And while undernutrition is a big problem, overnutrition is also a problem in this country. Okay. So we have a double-edged problem. So it's not only the undernutrition. The kind of foods, the fast foods, that we consume in this, particularly the cities, is a big problem. There's actually saying that when you don't take your food like medicine, you end up eating medicine as your food. That's a very dangerous situation where we all end up living on medicine because of the choice that we made in the foods that we eat. And I think we could avoid that. We could avoid a situation like the Juliana's child is in. And this is in our hands. It is something that we can, if the industries, if the regulators, there's a law in this country that was passed in 2012 that says wheat, oil, and maize flour must be fortified. Kenya Bureau of Standards has stated the levels of fortification. The consumers needs to be aware of that that law and how they can make use of it. That's why we are cooperating with him to find out how we can sensitize the consumers. There is a logo on every fortified food that is a green person saying Boresha Afya.
Well, I don't know. I was just guessing.
Yeah, when you go to the shelf, check for the logo.
Yeah.
There is a logo that says, which is only given by KEBS after certifying that the food is actually fortified.
Okay.
You can buy that food because it has the right minerals.
It has better nutritional value.
Exactly.
Okay. Finally, from you, Juliana, what do you advise to mothers, would-be mothers, and as far as nutrition goes, what they need to be considering and putting as priority?
I think the first thing I would like to advise is for the antenatal clinics. When women go there for their family planning pills or maybe services, they need also to be advised on these iron and folic acid, because they are normally given to a woman when she's 4 months pregnant. That is very late. And also as women, we need to learn. We need to be willing to expand on what we know, so that we make sure that whatever we are doing is not only for our good, but even for the good of our children. Because if you give birth to a child with a disability, it is not an easy task taking care of this child.
And we thank you for also sharing your story with us. It definitely will hit home with very many people to see that you're here sharing your story of something that could have been stopped. And we thank you as well, all of you, Gladys Mugambi, Adan, Kabelo, Juliana Auma, and Sam Ochieng, for being with us this morning. Nutrition Week continues, so make sure you put that as a priority. You are what you